Hello everyone. Down syndrome is one of the most common genetic disorder, with its incidence being to the tune of 1 in 1200 births in India. Because of its typical physiognomy, individuals with Down syndrome are easily identified by everyone, but it leads to the formation of many stereotypes and assumptions about their abilities and potential. They often have to face deprivation, neglect, and abuse too. And I think being pediatrician, the onus lies upon us to think beyond a level, empower them with medical care, to increase the awareness of the society and acceptance by the society. I am Dr. Asmita Patil, pediatrician from Navi, Mumbai, and I am going to highlight few nuggets in the management of Down syndrome which can help these kids achieve their maximum potential. As I said, diagnosis is not difficult as they have distinct phenotypic features. We need to extend our little extra care to cope up with their medical concerns. At birth, the main concern is identification of life-threatening anomalies like gastrointestinal atrasias, complex congenital heart diseases, and provide NICU care for surgical, cardiac, prematurity or feeding issues. Next crucial part is to confirm the diagnosis and reveal this diagnosis to the emotionally disturbed family and counsel them and give them confidence and support so that they can stand with this child with all their heart and positivity. Congenital hypothyroidism is 30 times more common than in general population, and if left untreated, it can further worsen the intellectual ability. Hence, TSH should be done on cord blood or day 4 of life. Even if initial TSH is normal, annual TSH is recommended as these kids are prone to get acquired hypothyroidism. GI anomalies like duodenal webs, motility disorders like GRD are common. Celiac disease is seen in 10% of Down syndrome children as a part of increased probability to get autoimmune disorders. Hence, TTG IgA should be done at 1 year and 5 years of age. Up to 50% of babies with Down syndrome are born with congenital heart defect. So, echo at birth and 6 weeks is must so that timely surgical intervention can be done. They are also prone to develop pulmonary hypertension later in life because of the narrow pulmonary vasculature. Hence, saturation should be periodically monitored so that whenever falling trend of saturation is documented, echo can be done to check for the pulmonary pressures. Ophthalmologation should be done periodically to detect cataract and glaucoma in newborn period, esotropia in infancy and myopia in toddlers and later age. It should be done at birth, at 6 months and then annually. Newborn hearing screening is must for every newborn, more so in babies with Down syndrome because sensory hearing defect is common and early intervention with hearing aid will help in speech and cognitive development. These kids are prone to develop anemia and leukemia, hence annual CBC is recommended. Growth should be monitored at every visit on special growth charts for Down syndrome. Down syndrome kids do have mild to moderate delay, but once a delay, always a delay should not become a stereotype because these kids are very much trainable. Early intervention with occupational and physiotherapy can help them gain the milestones for their potential. Children with Down syndrome are generally happy, but they do have a wide range of emotions like sadness, anger, aggression, which should be respected equally. Autism, learning disability, ADHD are also seen in these kids. Hence, appropriate developmental assessment should be done and intervention should be offered. Special child, special school is another stereotype. But with early intervention, these kids can become a part of inclusive school with one-to-one support and vocational training so that they can have a better productive life. This chart summarizes the follow-up of different medical concerns in Down syndrome children. Individuals with Down syndrome are stereotyped to be unemployable, but overcoming this, they are doing really well as chefs, athletes, actors, models, artists, and in many other fields. There are many NGOs which support these individuals for their holistic development. So friends, let us join together for children with Down syndrome, offer them comprehensive medical management, early interventions, family support, right inputs and guidance, and most importantly, the acceptance by the society. Thank you.